Dr. John McDougall and Dr. Hans Diehl are with us talking about reversing heart disease by eating the right foods. So, can you give us some examples of how this has worked? You have a special program for this.
We have 50,000 stories.
50,000 stories.
We have 50,000 graduates of the CHIP program. Now, this is not potato chips or
no. Tell us, what is the CHIP program?
It's a community-based program where people come for 40 hours of education. And we help them to understand the science of why we perhaps should make some wiser choices. And then we show them how to do it. And so as they come to us in groups of 50 people or 500 people, they begin to interact among themselves. There's a magic of working with other people. You're not the only one that is making changes. And
that's big, isn't it?
It is.
Because you feel like you're kind of the Lone Ranger. You're the only one over here eating your potato when somebody else is,
Yeah, but it's also an accountability structure.
Yes.
So if somebody's inspired, how do they find out about a CHIP program?
Well, they can go on a website. They can find it right there. There are CHIP chapters all over the country. They can sign up and they can join the program. It's run in churches, it's run in hospitals, it's run in corporations.
Community centers.
So you should spread this far and wide in order to get as many people involved with the CHIP program as possible.
And I've been involved a little bit with these CHIP programs, and they do exactly what needs to be done. They take people who are struggling with disease or they want to prevent disease and are hooked on the American diet, don't know anything different.
Sure.
And they teach them, they give them community, they give them support, they give them success. I mean, and for almost no money at all. It's just an amazing program. And Hans and I have been together for probably 25 years. And I've seen his work. And I would have to say he's done more. And this is not an exaggeration. He's done more to help people from around the world in a practical manner than anybody I know through these CHIP programs.
That's exciting.
I didn't hear that right. Can you say that again?
Hans Diehl, Dr. Hans Diehl has done more to help the average man and woman in this country. Over 25 years of work, just getting in their faces, getting in their homes, and tell them that they don't have to be sick, and then showing them how to do it through the CHIP programs. Everybody needs to be involved in these.
Hello, everyone. Well, thank you, Dr. McDougall, but this is really not my story. This is God's story. Here's a story of what God did in my life, from a young Lutheran teenager in Germany to becoming the conceptual father of lifestyle medicine, which has emerged now as the new and fastest growing medical specialty in many countries. As I look back over my life, I can identify 9 major doors that God opened for me. He opened them for me to fulfill my commitment of helping people to not only live longer and healthier lives, but to also develop clearer minds that will be needed to make good and wise choices and decisions as the great controversy moves towards its final chapter very rapidly. Here is our guiding verse for tonight's devotion. It comes from Jeremiah 29, verse 11. For I know what I'm doing. I have it all planned out. Plans to take care of you. Plans to give you a future you hope for. This is the assuring message that God is sending through Jeremiah to the Jewish people in a 70-year Babylonian captivity. I have it all planned out. Plans to take care of you. Plans to give you a future you hope for. And that's the kind of assurance that I want to claim tonight for myself, and that's what I want to extend to all of you. And just as God opened the doors for the Jewish captives in Babylon, so he will do the same for us. And here are my 9 doors that I identified in looking back over my life. Here's door number 1, enlargement of my concept of God. I was the oldest of 6 children, born into a Lutheran family, into very humble surroundings. We had nothing. It was right after World War II, but we had a baker that would come every week to bring us the Graham bread. We loved this bread. But this Adventist baker would also engage my father in some very interesting discussions, and I was all ears. I learned that Jesus was not only the Redeemer, the Savior, but he was also the Creator God. And if that was true, then this was the only religion in the world where a God who made his creatures would also die for them and put them on a bridge to get back home. Ultimately, we all became Seventh-day Adventists, and we began to realize after a while that this baker not only brought us the weekly bread, but he also introduced us to the bread of life. And what a difference that made. We adapted very well to the Seventh-day Adventist church. And then I made some good friends with some of my young people there in the church. But tragically, before too long, they actually moved to Canada. It was a great loss for me personally, but they began to write, and they would write to me regularly. And they would always have the same idea. Why don't you leave Germany behind? It's too small. Come to Canada. It's a huge country. You can travel for 5 days on a train and you still don't have to show a passport. The same language, everything. It's huge. It's the giant, the economic giant of tomorrow. Here is your future. Well, I was 13, 14 years of age. I first had to finish my schooling, mittlere Reife, and then I joined the Krupp's company in Solingen that was well known for producing electrical appliances such as electric toothbrushes and bathroom scales and coffee grinders and mixers. This was a very prominent company, and I took my 3-year traineeship there, and I had a special interest in marketing and in export affairs. And before too long, I recognized that as they took me on as an employee, that maybe I should listen to my friends in Canada. And I recognized that the Krupp's Corporation had a branch office in Montreal, and my friends were in Montreal. And of course, you can see what happens, right? I would come to Montreal and work for the Krupp's branch in Montreal, and would get the new assignment by the branch manager. And he said, what I would like you to do, you have a background in marketing. What I'd like you to do, I like you to have as your task to change the drinking habits of Canadians. We want to introduce the idea to Canadians that using coffee that has been sitting there on the shelves for weeks and months and years is not the way to really enjoy the coffee bean. You need to use a Krupp's coffee grinder. You have to grind them, and then it frees the aroma, and it becomes an exotic, wonderful experience. And it wasn't long before I found myself, of course, in the Adventist church in Montreal. I made new friends, and then they asked me the question, well, what are you doing? What is your job? What's your career like? And I said, I'm going to change the drinking habits of Canadians. I'm showing them how to drink coffee with freshly ground coffee beans. And they looked at me and they said, are you an Adventist? Yes. Oh, you see, I never made the connection there. And so now I was in a new country and I didn't quite know what I should do. But then I made the discovery that there was something called social upward mobility. That meant that whatever you wanted to be, you could become. I mean, in Germany in those days, if your father was a plumber, you would become a plumber. If your father was a university professor, you probably would be in the university academic career. If your father was a salesperson, chances are that you would be in sales. You know, this is the way it was. You stayed pretty much on the same social level. But in Canada, in the USA, you could become anything you wanted to become if you're willing to pay the price. And I was willing to pay the price. It didn't matter what I had to do. And so I left the company and I signed on to work as a miner in a very northern bush area in the province of Ontario. I had no idea about details. It just said it is in the bush. There are no communities around. It's a fairly forsaken area, but the money is good and we're paying well. And there's no way that you can spend the money. You can save everything you want to save. And we have many, many miners that are coming to work for us here, and they send their money home to their families. And if that's what you want to do, this is the place to be. And a friend of mine and we began our journey to the northern frozen part of Ontario. Getting close to the area where the mine was, we saw a big sign. Here you're entering the coldest spot in Canada. With wind chill factors, they had registered minus 72 degrees centigrade. Well, but it didn't matter, because I knew that I was going to make good money here. I would put it aside and I would go to an Adventist college. I would finish my bachelor's degree. I would get ready for medical school in Loma Linda in Southern California. And yes, there was 10 months snow and the rest was summer. It wasn't very much, but it didn't matter. You do what you have to do. I was working in a warehouse. I had 2 jobs there, actually in the warehouse, and I was cleaning the rooms of the miners there. I made good money, and I actually enjoyed being there. However, my idea of being able to learn some of the colloquial English didn't quite pan out, because I began to realize after a while that these people, well, they spoke some kind of an English, but it was really a profane English. It was profanity riddled. I mean, many, many times I heard words that I had never heard before, and I would look them up in my German dictionary, and I couldn't find them. And I thought to myself, this is kind of strange. So I would go to my foreman and ask him, do you know what this means? What does it mean? And he said, don't ask me. Don't ask me. And I knew there was something not quite right. And so when I heard these expressions and different expressions, profanities, I would go to my dictionary and look it up. And if it wasn't there, I began to realize maybe I shouldn't integrate that into my vocabulary. I mean, they were actually poking fun at me from time to time, because they said he wants to go to medical school and he doesn't even understand some of the basic words. Come on, come on. But I was clear what I wanted to do. My goals were clear. I saved my money. Ultimately, I enrolled at Kingsway College. I got my bachelor's degree. Then went to Andrews University in Michigan. And there I made the wonderful discovery of a gorgeous, lovely lady, actually a concert pianist who was also on the faculty at Andrews University. And I became a very, very lucky man. God had plans and God delivered. It was unbelievably beautiful. And so after my marriage and 2 years at Andrews University, and it was time to move to Southern California to move towards medicine, because I had learned that everything is possible in Canada and in America. And in those days, Adventist young people either became a teacher or a nurse or a dentist and a physician. And I felt the claims of God on my life. I wanted to serve him, and why not do it in the best possible way, where I have outreach opportunities to people, to be of service to them. And so as I was waiting for getting into medical school, I was taking 1 year in the School of Public Health at Loma Linda University in public health. And just at that time, the dean of the School of Public Health, Dr. Mervyn Harding, he called me up and he said, Hans, I'm going to Los Angeles. I'm giving a lecture there. I have about 1,000 people there waiting for me. I give 12 lectures there on public health issues, promoting health. And would you like to come with me? I mean, when the dean asks you, an erudite man with 3 doctorates behind his name, I mean, you feel very, very fortunate and privileged to be invited to go with him. You know, we are finding ourselves today, this is now the 1970s, we find ourselves in a situation where we begin to realize that most of our illnesses are actually lifestyle related. They relate to how people exercise, how they eat, how they drink, do they smoke, do they know how to relieve their stress properly, do they get enough sleep, are they careful with alcohol? And he said, these are the kind of drivers of these modern diseases now. These are the chronic diseases. And in medicine, we have no real cures. Oh, we can take care of the symptoms and make people more comfortable. And that's very important, of course. So when you have heart disease, when you have angina pain, you can take a nitroglycerin, and within a few minutes, your vessels begin to open up and the blood can flow more readily and the pain is gone. Yeah, we can do this. But he says we can also do a stent, we can do bypass surgery. But he said we don't really cure these people because there's a likelihood that these vessels begin to occlude and close up again unless people make lifestyle changes. And he said, because of the recognition that these chronic diseases are becoming more and more prevalent, particularly since the diet began to change around that time in America and then later on around the world, where we went from slow food to fast food. We went from eating at home to eating out. We went from eating potatoes to eating potato chips. We went from eating beans. We went to burgers, and we would go from drinking water to drinking soda pops. I mean, he said these diseases will become more and more prevalent. We will be seeing more and more obesity and hypertension with the high salt intake, for instance, and we will also see more arthritis. These are the diseases that we cannot cure with medications. We can soften their impact, but the cures will come probably by helping people to make lifestyle changes and to go back to a simple diet, get into a walking program, to get their 7-8 hours of sleep, to drink more water. These are the kind of remedies that actually have been advocated for some many years by a writer by the name of Ellen G. White. Well, he said, we started a doctorate in health science last year. And I'm wondering if you might be interested in taking a look at our program. Its focus is largely on the first 2 years of medicine, the functional medicine subjects, anatomy, physiology, biochemistry, and so on and so forth. But then the last 2 years of the program are devoted mostly to therapeutic nutrition, to exercise physiology, to stress management, to communication skills. How do you develop good slides that will be creating interest within the audience? And he said, and you know, I thought of you with your background in marketing, that you might be interested in taking a closer look at this, because as a physician, you'll be pretty much into a one-to-one relationship most of the time. But when it comes to public health and you have your doctorate in health science, then you would have the opportunity in dealing with group appointments. You can see 5 or 10 patients. You can lecture to groups of people, 50 people, 100 people, 1,000 people. You can be on television. Would you give some thought to this? When I came home, you know, I told Lily, my wife, all about it. And she said, well, she said, are there any job openings? I said, no, there's no job openings yet. You have to go on faith. And she said, well, let us think about this and pray about this. And maybe we can discuss it with Dr. Harding a little bit more. We did. I enrolled and I graduated. I enjoyed the program. And I was hired by Loma University in the School of Public Health. I had graduate students to teach as part of my responsibilities, and they began to ask questions because they were asking me about a man by the name of Nathan Pritikin. They said, have you heard of Nathan Pritikin? Oh, I said, don't talk to me about him. He is just a California quack. I mean, he is an engineer and he's running a clinic there in Santa Barbara where he claims that he can reverse heart disease, he can reverse diabetes, he can reverse hypertension, he can reverse arthritis. And he can teach people how to eat more and weigh less. I mean, no. And so I drove 168 miles from Loma Linda to Santa Barbara in California to check out this place called the Pritikin Longevity Center. When I got there, I met Mr. Pritikin and introduced me to some of the patients there. There were some 50, 60 patients there. They came from Honolulu. They came from Vancouver. They came from New York. They came from Hong Kong. They came from everywhere. And most of these people are very, very affluent people. I mean, they came with some of them came with their private jets. And they said, we've been to the best medical centers. We've been to the best universities. We had the best physicians. We had the best medications. We had surgeries for various illnesses. And yet we're told that these are chronic diseases and there's nothing you can do about it. High cholesterol, what you have, you have. No. Triglycerides, when they're high, what you have, you have. You probably picked the wrong parents. It's a genetic thing. There's nothing we can do about it, really, to turn these diseases off, to provide a cure for these diseases. This man was different. He looked at this whole situation as an engineer. He looked at cause and effect. We know the causes, he thought, and these causes were the diet, the exercise, or the lack of it, and the modern, conveniences, and the enormous stress, and so on. And he said, we will train you. And he provided 3-4 lectures every day to these people for 26 days. These people would walk 2 to 3 hours a day. These people would eat very simple meals. These people would eat fruits, vegetables, whole grains, and legumes, beans and lentils and peas. And they would have some nuts and maybe some avocado, and that was it, and lots of water. He was very careful with any refined foods. That also left out then the oils. And he was in general very, very careful really to drop the fat content to less than 10% of total calories instead of the usual 35 to 40% in the American culture then. And so these people initially had to make some adjustments in their taste experience, but after about 2 or 3 weeks, as I talked with them, they said, no, it's fine. I think the chef is improving. Well, the chef didn't really change. Your taste buds begin to change. It takes about 2 to 3 weeks, and education would change the interpretation of taste upstairs here. And that makes all the difference. And after a while, you will no longer lust for these treasures, culinary treasures of the past. They were gone. They no longer meant that much to you because you wanted to be healthy. You wanted to see your grandchildren grow up. You wanted to have the best life possible, the longest life possible, and they were willing to make the change, and they began to enjoy it. And so you see, I went from treating disease as a physician that went the route of a doctor in health science to promoting health, to now beginning to actually reversing chronic diseases, which nowadays consume 86% of the American health care budget. 86% of what we spend on medical care in America today is spent on managing the symptoms of chronic diseases without really becoming curative, because that has to do with lifestyle medicine, where you are then now empowering people to make lifestyle changes. And so I came home and I said, Lily, another shock, another surprise. This Pritikin situation, there's something to this. I've never seen people that were taking 50, 60 nitroglycerins, and all of a sudden after 3-4 weeks, they're down to 5 or 10 nitroglycerins for the angina pain. Lily, 67% of these people are no longer on high blood pressure medication after 4 weeks. Lily, their physicians are taking them off because they said, your blood pressure is so low, it would be dangerous to keep you on these medications. And by the way, you don't have to worry about the side effects of these medications anymore. I mean, diabetics, within 3 to 4 days, the blood sugars would drop. The insulin amount that was needed had to be reduced because these people would become hypoglycemic. I mean, the power of the body to heal itself was very, very evident to me at that time. I could see it. But I also recognize that the body wants to have and is dependent on the proper raw materials: fruit, vegetable, whole grain, legume, and maybe some nuts and some avocados and plenty of water. And so I really enjoyed learning the effect and the impact of a lifestyle medicine program on chronic diseases that would take place very, very rapidly, shockingly so. If I would have not been there to see it with my own eyes, I would have not believed it. And so I was hired as a research director and as an educational specialist, and I would team up with Loma Linda's biostatistics department, and we would create the database and we would send it to Loma Linda, and they would do the analysis and they would then publish the results. It was a most exciting place to be at. But I developed in due time some second thoughts, because remember I said I came from a humble family, a humble background. I came from a really poor family, and I was a little bit uncomfortable that this program was largely only available, affordable to the affluent subset of our society. I wanted to have more democracy. I wanted to reach out to everybody. And so I began to think about, what can I do? Also, I began to realize that, yes, these people are paying good money to come to this program here. They spend here 4 weeks. They're doing very, very well. But how long will this lifestyle change last? Especially when they get back home, the same fridge, the same friends, the same church potlucks, and so on and so forth, and the same physicians who may not understand these new ideas and may just sort of brush it off. May that really last? And so we began to look at 6 months and 1 year follow-up data collection programs, and I began to realize that the new lifestyle the habits began to decay in time. And I said to myself, I need to do something different. I need to have a program where I can go to the people instead of the people coming to me. I need to go where they are, and I need to change their community. I need to change their restaurants. I need to change their food supplies. I need to work with their physicians. And then we have a better chance in creating a more lasting lifestyle change. And with that, the kind of a goal of healthier and longer lives. And so I was thinking about these ideas when I also went into a 2-year postdoctoral fellowship in cardiovascular epidemiology. And when I was done with that, lo and behold, the phone rings and my dear friend, Dr. Sid Kettner from Canada is calling me, and he says to me, Hans, I want you to come to Canada, to my little town here, and I want to give the annual preventive medicine lecture. I've done it for the last 3 years, but they need to see a new face and hear it from a different person. Can I sign you up for giving a 1-hour preventive medicine lecture to the town of Creston, 4,000 people? I said, well, Sid, tell me, what is the purpose of the lecture? Well, I want to have healthier people. I said, no, wait a minute. I said, I don't think that one lecture would change a person's behaviors, because when you talk about preventing disease, or perhaps even arresting disease, or maybe sometimes even reversing disease, you need to change people's habits, because the habits drive the health or the disease. And he looked at me and he said, well, he looked at me over the phone, right? And And he said, and how do you change habits of people? I don't know, he said. I said, well, you have to teach them to do something for 21 days. I said, for instance, if they brush their teeth with the right hand, toothbrush with their right hand, you just tell them, from now on, I want you to brush your teeth with your left hand. And chances are that many people may not even be able to find their mouth to get the toothbrush in because they're not used to it. But if they do it 3 times a day for 21 days, the psychologists tell us it becomes a new habit and the people become ambidextrous. They can brush their teeth with either hand. He said, that's very interesting. So does that mean you are putting our friendship on ice? You're jeopardizing our long-standing friendship? You're not doing me a favor? I said, well, look, I have a wife, I have 2 children, and you know, and I really don't believe that I can do much good with one lecture. I just antagonize people. You know, I mean, you tell them you want to lower your cholesterol, just eat less cholesterol-containing foods, cut back on the saturated fat. And I take all the foods away that people love. And I tell them don't use alcohol and da-da-da-da-da-da-da. It's that, no. I don't think, I would probably do you a disservice. I don't think I should come to the little town of Creston. Oh. And then he said, you could change the habits though, right? If you do something for 21 days, may I invite you to come for 21 days? And I was hung by the tongue. And I said, well, let me talk to Lily about this first. He said, if you come, I do everything to send all my patients to the program. How many days do you think you would do it? Well, I said, it probably would be 4 weeks, and we probably go 4 nights a week for 1.5 hours to 2 hours. So that would be about 2 hours times 4. It's 8 hours instruction a week times 4. That's about 30+ hours. We do blood tests and risk factor assessment before the program starts. And then again, after the 4 week is over, and then we analyze the data and we get them into a maintenance program. Would that sound okay? Oh, he said, that sounds great. I'm totally behind you. I've talked to the newspaper people. We get the word out. And he did. And 400 people showed up for my first CHIP program. CHIPS is C-H-I-P, stands for Coronary or Complete Health Improvement Program. CHIP. It was the birthing of the CHIP program. 16 lectures talking about atherosclerosis, the relationship of diet and disease, chronic disease. We would talk about hypertension. We would discuss diabetes, obesity. We would discuss how do you find appropriate rest? What about the issue of alcohol and cigarettes and caffeine? You know, we begin to talk about all these kind of things in a very well-illustrated lecture format. I used to have about 70 to 80 slides, PowerPoint slides for every lecture. And after the lecture, Dr. Kettner and I would answer some of their clinical questions that they had, their nutritional questions. And when the clinical results came in after 4 weeks, they were almost identical with the results that Nathan Pritikin achieved by putting people into a residential center. In our situation, they could do whatever they wanted to do. After the lecture, if they were upset with me, they could go to McDonald's. Nobody would stop them. But I began also to work with the restaurants. I began to work with the stores, the food suppliers, and they began to make changes. And they would have a special Dr. Diehl's lasagna at the restaurant. It became a big seller for the restaurant there because people had now the education and they wanted to have a healthy meal. And the restaurant made good money because they just replaced the meat in the whole grain lasagna with some of the meat analogs. See? And the people didn't even really fully realize the difference in taste. They just enjoyed it because something had happened up here. They knew this was the right thing to do, and they began to enjoy this, and it became a cause célèbre. It became much talked about concept in the town. People began to talk about cholesterol numbers. They talked about hemoglobin numbers. They talked about what's your heart rate like when you wake up in the morning. They talked about the relationship of heart rates to longevity, and the more you exercise, the slower your heart rate actually becomes and gets during the night at rest. And so the whole town became a chip town. And then it moved to the next town, a neighboring town, and we had 1,500 people that signed up for our second chip program in Canada. And it moved from there to another town, Kelowna, and we had 2 programs in a row there, 2,000 people in each program for 16 nights. And then Ottawa called, this is the capital of Canada, and the Parliament became interested in knowing more about this program because they thought maybe this is the answer to our medical crisis here. And they assigned their epidemiologist from the government paid epidemiologist to my program, and they collected the data before and after, and they began to analyze it. And yeah, it confirmed what we had done before. These were great moments. And then the program moves out of Canada, and I receive a call from the Quiet Hour. The Quiet Hour is an Adventist outreach program that sends people into different countries to do missionary work. And the Quiet Hour came to me and they said, you know, we are in India. There is a lot of interest in the Adventist message. Many people join the church. However, most of the people are from the lower classes, and their tithe is not enough to fund a full-time pastor, nor can they build a church. We need to have a different economic mix for the people that come into the church. Would you be willing to go to Bangalore, one of the big cities, 5 million people, and try to reach into the upper, you know, the upper class people with a health message, and then hopefully open up their hearts to the deeper meaning and search for life. I had no idea about the Hindu religion. I had no idea how to get a group of people to come into a program series like this. And then the phone rings and a man calls me up and he says, my name is Ramesh Pai. I'm from India, and I would like to see you if I could have an appointment. We make an appointment. He comes, tall man, dignified man. And he said, I'm Ramesh Pai. I'm from Bangalore. Do you remember Bangalore? That's where the Quiet Hour wanted me to go and do a special program, a health program to reach the affluent people. He said, I'm from Bangalore. I have had bypass surgery. And after 2 years, the grafted vessels began to occlude again. They are no longer functioning very well. And I have recurring angina. And I have had a medical team that traveled with me around the world to looking for the answer of how to take care of angina pain, atherosclerosis, heart disease. He said, we went to Japan, we went to Germany, we went to England, we went to many, many countries, and we ended up last week in Santa Barbara, the Pritikin Longevity Center. They spent 2 days there. They listened to the reports of the people. They were astounded, and they offered Mr. Pritikin, an engineer, to come to Bangalore and to lecture to his affluent friends. Mr. Pritikin, I'm very sorry, but our clinic is just taking off. There are more and more people looking for the answers that we offer people here. We now have 89 people in this session. I possibly couldn't leave them, but I used to have Dr. Diehl working for me. He has taken some postdoctoral work in epidemiology, and he's probably available. You might want to double check with him in Loma Linda. Well, here's the man. And he said, We understand that you were the research director and education director for Nathan Pritikin, and we understand that you are had a very good track record in Canada. Would you be open of coming to India? Well, I have an invitation from the Quiet Hour to come to Bangalore sometime. He said, wow, that's great. We'd be glad to team up with the concept of the Quiet Hour and bring you to Bangalore. And I said, how many people do you think you might have in my program? Well, he said, probably 1,000. 1,000? How would you get 1,000 people? And he said, well, you know, we can go to the Rotary clubs. That's where many of the business people are usually. And we can reach out to them there. And I said, well, how do we get into the Rotary club? And he said, well, I'm sorry. He said, maybe you don't know this, but I'm the president of Rotary for all of India. And if I write to the clubs in Bangalore that I will be coming on a certain day at 8 o'clock or 10 o'clock or 12 o'clock or 2 o'clock or 4 o'clock or 6 o'clock, they will be there. And I can introduce you then, and you can give an introductory lecture and let them know what the CHIP program is all about. CHIP, the Complete Health Improvement Program. Really? Well, but I said, I do some risk analysis, risk factor assessment before the program and after the program. I have some blood tests that I need to have done. And the only way that I can do this is on 1,000 kind of a group clientele. I can only do it if I have automated analysis machinery in place. And he said, well, you'll be glad to know that in our hospital that we have, we just installed a brand new Kodak automated analyzer. And the top man, a PhD, just came back from America where he was trained to run it. You see, the doors open up more and more. I said, well, that's really great. But I also need to have some physicians and some nurses to help me with 1,000 people group. Oh, yes. And he said, well, we probably can help you there too. He said, let me talk to my cousin. My cousin is the dean of our medical school. We are the largest privately owned medical school in India. And I would just tell him I need to have, how many doctors do you need? Well, 5 or 6. How many days? Well, we worked it all out. He said, no problem. And nurses, there's a big nursing school here run by the Catholic hospital here, and we have a very good relationship with them. I open the doors for you with the Mother Superior, and these nursing students in the last year, they'll be very happy to join your exciting program and take the blood pressures on a regular basis of these 1,000 people. I said, how do we handle the finances? I said, if I come, I'll probably be here for about 8 weeks to get everything organized and then to run the program itself and then to mop up afterwards and collect the data and so on. How do we do this? He said, well, let me make a proposal to you. If the Quiet Hour will take care of your flight tickets as they were going to do anyway, then we will take care of everything that happens in India on your behalf. Hotel, food, everything is taken care of. Doesn't cost you anything to advertise the program. We'll do everything for you. We have the means, we have the connections, and we'll bring 1,000 people into the program. These will be affluent people. And affluent people came. 1,500 people. And they came with their shirt collars wide open like this because they were showing off their tattoo. They all had tattoos. Just about all of these people had tattoos. I mean, these men showed off their tattoos because that meant they were millionaires in terms of their currency, because the tattoo was a scar from the bypass surgery. These people had been to America and had done their surgeries there, but somehow nobody told them, you need to make some changes. You should really live like a real Hindu lives, on a vegan, simple diet of foods as grown, as it comes out of the hand of a master designer. It was amazing. And when the data came back after the 4-week program was over, it was absolutely amazing. It worked just like a charm. There was no difference really between the Indian data and the Canadian data and the data that Nathan Pritikin had. Pritikin had a little bit more stronger benefits than we had because our population was free living. But these people in India, they were committed. I mean, they said, we're living on the edge with these surgery behind us and now clogging up again. We need to do something. They brought their personal chefs into the program. We had 1,500 people, and the results were published in Time Magazine of India, in the newspapers, radio interviews, television interviews. The leadership of Bangalore got behind this project, and they began to start forming their own Healthy Heart Club. They had their own store that they equipped with foods that were foods that we approved of. These were usually not a lot of processed foods, but these were basically fresh produce, fruits, vegetables, whole grains, not white flour. Brown rice, oh yeah, I've introduced them to brown rice. It was quite a procedure. I mean, it was not easy to get. So India was a big, big success. The Minister of Health, he had just retired. I came to the graduation ceremonies, and he said, isn't it amazing that a German-American man has to come to India and bring us back to our Hindu diet? And then as I get back home, the phone rings again, and I get a phone call from the chief of staff, medical director of one of the hospitals in Kalamazoo in Michigan. And he said, we heard of your success in Canada, and we are interested in making our hospital the hospital that people go to, because it not only takes care of disease, but it also promotes health. Would you be willing to come and help us to do this? And we're looking for about 900 people that we plan to enroll in this program here. We take care of everything, unlimited budget, and we just like you to make a commitment to us, and we would be very, very honored if we could have your services. I said, Lily, our ship is coming in. You know, we have been giving and giving and giving. This is not a business. This is a ministry. We are seeing ourselves as being on God's trail. And so instead of having high fees for my services, we just want to launch this project, this lifestyle medicine concept, and let it become a social movement so it will be able to survive and maintain itself. And I was on my way to Kalamazoo. But before I got there, my sweet wife sat me down and she said, darling, you're traveling around the world. You're making everybody healthy. And you forget that you have a lonesome lover at home. You have 2 children that adore you and they miss their father. We need to make some changes. What can we do? It just was like a dagger cutting into my heart. There she is, a beautiful lady, accomplished, sweet, nice, great cook, great mother, erudite. Oh, it really hurt me. And I said, honey, let me think about this. We'll find a solution to it. But let me just get back to Kalamazoo to start my program there. There are 300 people waiting for me. The moment I got to Kalamazoo, our first CHIP program was over, and now came number 2. Each time it was 300 people. And when I began the second program, I had the good fortune of meeting someone that was representing a videography studio. They were making movies. And then I got on the phone and I said, my name is Hans Diehl, and I'm looking for a studio that can videotape me, film me as I'm giving 16 lectures. Would you be in a position to help me with that? And they said, are you Dr. Diehl? Are you the one at the hospital there? Are you that is being written up in the newspapers? Well, it's okay. Yeah, I said it is. He said, we would love to work with you. What do you need? How many cameras do you need? I had no idea. Well, you need to have one for your slides, for the PowerPoint. You need one for the audience and one of yourself. You need at least 3 cameras, right? Yeah, I guess. And do we have to do the post-production too? I had no idea what that meant. I mean, I was a greenhorn in this field. And they said, well, we'll help you. And then I asked him about the price, and he said, well, let me discuss it with my partner here. Why don't you give us a call tomorrow morning? I called Lily up that night and I said, Lily, I think I found a way to stay at home and still run the CHIP program in many, many cities, in many, many countries. I think we can video film these presentations, and then I could stay home. Oh, she said, wouldn't that be wonderful? And the next morning when I called, I said, you know, my wife was rather curious. She said, do you have any idea of what qualification this studio has to actually tackle this job? And I said, so I just wondered if you could give me some references that I could check out. He said, references? Yeah, I said, references. Why should I go with you as a studio to film me? Maybe they're, and then he said, listen, we are the official videographers of Bob Hope. Bob Hope? He was the lead comedian here in America. He was the one that was sent by the government to all the militaries around the world. Bob Hope, he was in Vietnam, he was everywhere. Bob Hope, he was the clown, he was the comedian, he was the top man. And they said, and you have, and they said, and we have exclusive rights. We are the only one, wherever Bob Hope goes, our team goes to accompany him. Would that be a good reference? Taken care of. Taken care of. No more questions. And then he said, and we talked about the financial package for you last night. And my partner and I, we decided that we'll give you a big discount because we really believe in the mission that you have in making this a healthier town. We want to help you fulfill your dream of reaching out through films and still be at home with a lonesome wife and with 2 lonesome children. And that became the solution. Kalamazoo became the place where we filmed our lectures that have been with us for many, many, many years. And I'm at home now, and the phone rings, and this time it comes from the Chicago area, a town of Rockford, 170,000 people. The hospital said, we have heard of your project in Kalamazoo, Michigan. We had sent some of our doctors there to actually infiltrate the audience and to sit there for 2 and 3 days, and we're very, very impressed. And we are prepared to bring you into Rockford because we would like our hospital to be the go-to hospital. There are 2 others here, but we would like to offer them not only the best medical services, but also health promotion services and lifestyle medicine concepts that may arrest, in some cases, the diabetes and the heart disease and the hypertension. And we actually would like to bring you in. There's no limit to the budget. We're here to do whatever you need. And I said, let me talk to my wife. Remember, I had just made a commitment that no more traveling. What would I do? I got on my knees and I said, Lily, just one more CHIP project live. We have an invitation to do something near Chicago in Rockford. I said, Lily, you understand from your statistics studies for your own career, you know that we have no assurance that the film program will have the same results as you will have if I would do it live. And so they plan to have probably about 2,000 to 3,000 people enrolled in the program. That means that I can do several programs there, probably 3 a year, 300 people each. And I like to have one program that is done by video and one program that I do myself, and then we compare the results and we see if it works. If it works, then you have me home, because everything would be going via films, videos. And then the CEO came to me after I arrived in Rockford. I had signed the contracts and so on, and he said to me, you know, Dr. Diehl, we just got a special $1 million grant from the state authorities to make available to promote health, healthy living, health promotion in our town. We could make that money available to you. We could hire some biostatisticians that could do the data collection for you and then also evaluate this. And then you are no longer being possibly misunderstood in actually doing your analysis of your own data. Creates biases. We'd be glad to do this. We had 3,000 people over the next 3 years in our CHIP program. We had 26 restaurants that became CHIP-approved restaurants. That meant they had at least 5 menus, meals that were CHIP-approved. 3 were whole food, plant-based, vegan. 1 dish was 3 ounces of chicken, and the other dish was 3 ounces of fish, because we didn't really want to make this sort of a vegetarian dictatorship. We wanted to give people choices, and when they would come into the restaurant, they would bring their friends, and they were not always ready for going total plant-based. And so this became a big success story in Rockford. The people also began to realize that they could reduce their food bill by 35 to 45% by moving towards foods as grown, foods that come out of the hand of the master designer, foods that didn't come from some kind of a factory farm, that didn't come from the conveyor belts. These were foods that were not loaded with sugar and salt and fat. These were foods as they came loaded with nutritional value, nutritional concentration. And we published 12 scientific papers in some of the best medical journals in America, and the word spread. It spread so well that we became invited to make the program available in New Zealand. I went to New Zealand. I trained facilitators to run the CHIP program, and 52 churches, Adventist churches, signed on and became community-oriented programs to reach people with the gospel of health and the gospel of kindness. And maybe it becomes the right arm of the message. It wasn't very long when we got another call, this time from Australia, and it was the CEO from the Sanitarium Food Company. This is the largest Adventist or church-owned business in the world, 2,000 employees. And they said, we understand that you have done a great work with the CHIP program. We would be interested in inquiring if you would make a license available to us so that we could run the program in Australia. Well, I had just turned 65. I talked to Lily about it, and then we called back the CEO, and we said, well, we wondered if you would be having some business sometime here in the USA, maybe in California, and you could visit us in our office, and we can perhaps begin to get better acquainted. They said, yes, we'd be glad to do this. As a matter of fact, I said, I would be prepared at the age of 65 to turn the program over to you worldwide. Wow. They came, they saw, and they signed on. They acquired our mission-driven CHIP program. And they said, here's what we plan to do. You have had this baby for 25 years. You have taken good care of it. You have published many, many articles. In the meantime, it's now 51 scientific articles. with the team. We would like to dress up your baby and turn that baby into an adult. It's time for an upgrading of your books that accompany the video programs. It's time to upgrade the videos. Some of them are 12, 15 years old, and you can see the people, the audience there with hairstyles that are from yesteryear. We need to make some new videos. They invested $3.5 million in creating a new video chip program, 19 videos, new books, new materials. I had just gone to heaven. And in the contract that we signed, they also spelled out that I would be hired, offered at least the role of a consultant for the next 5 years to help make the transition more smoothly. And then my wife said to me just before we had signed the contract, and she said, honey, what does our pension plan look like? Did you squirrel some money aside for a rainy day? I mean, is there something there for our retirement years? I mean, it was a rhetorical question. She knew the answer because we had put everything that we had done, anything we received, we put into our ministry. God was good. He took good care of us. We never had any worries. She made a very good living as a musician and as a well-known piano teacher, professor. And so when the contract was signed, I showed it to her and I said, Lily, how does that look? And she never asked me again about the pension plan, about the money set aside for a rainy day. God took care of us. And so as we close this meeting, here's my call to action, and that is, we are all called to be channels. We all are called to become doors for Him so that His blessings may flow out to others through them. As physicians, we have great opportunities. We're respected members in the society. We could enlarge our practices by perhaps bringing some of the nutritional concepts into play, the lifestyle medicine concepts, which are now available as a board-certified specialty in Germany and some 42 countries. Lifestyle medicine, you might want to go to the website, American College of Lifestyle Medicine. It has been a wonderful journey to see how God has taken care not only of the Jewish people during the 70 years and then opening the doors for them, but He has also taken care of my wife and me in a very marvelous way. He said, I have the plans for you to take care of you, plans to give you a future that you hope for. And so we come to someday to the last door to open, and that is from here to eternity. And it's my wish and my prayer that you would be among those who invested themselves in serving others. And you would hear the welcome from the King of Kings. Welcome. I have loved you with an everlasting love. You belong to me. God bless you all. Good night.